So now I'm pulling back on to check for the residual. If the residual is 1/4 of the previous feeding, then I would stop. I would push the feeding back in slowly, and then I would wait 30 to 60 minutes before checking the residuals again, before trying to give them feeding. But if it was less than 1/4, then it would be okay. So this one is fine. I'm just gonna keep this. Okay. So now that I have checked the residuals,
we have our primary bag here, and the line has already been primed.
I'm going to put the feeding in. It's going to be 4 hours worth of feeding, so I'm going to put it into the kangaroo bag. I'm going to put the date and the time and label the bag. Then I'm going to make sure that I attach it to the patient.
Wait, are you going to be here again to practice?
Our additional.
Most likely tomorrow.
I'm going to start the pump at a slow rate in order to check the patency of the tubing, and I'm going to then put the prescribed rate and the volume to be used into the pump. I'm going to start the pump and watch and make sure that everything is patent. I'm going to check the patient's respiratory status, their coloring, and I'm going to be checking just their overall condition. When the bolus feeding is finished, I'm going to clamp this off, take off the tubing,
Okay, and then we're going to
and
clamp
then
it
I'm
off
going
again.
to flush it with 5 to 15 milliliters of sterile saline.
Downtown.
Cap it. Same sterile technique.
Oh, yeah.
And then going to document the procedure and make sure that I recheck the patient and make sure that everything is fine and that the
Place the
condition
medication
is good. Okay, thank you.
with a label.